Dr. Hanisyam. Welcome to the Get Healthcare Weekly Chat, where every Monday we meet up for 15 minutes and talk about some issues, I suppose, that are relevant to the site and the project and answer questions that people might have. This week, myself and my family have all had the flu, coughing, spluttering, temperatures for the smaller baby. He's at a bit of a temperature. Um, and now myself and my wife seem to have gotten the brunt of the flu on Monday morning after he's just started to get better. So I said I might have a chat with you about it, and maybe if you could run through some short-term preventative cures and then long-term preventative cures. Or I suppose there's nothing really. I mean, we did go to the pharmacy. They told us some, when he was in the middle of his fever, maybe some Calpol, some Nurofen, some Vicks Vapor Rub. She suggested that we put Vicks Vapor Rub on his feet and put socks over that. That was a good way of kind of getting the cough out of him. As you can hear, I haven't done myself. So maybe that's a good position to start, and we can have a chat about that.
Yeah, sure. Yeah, you're right. Now it's going to there's change of weather, so that's why the weather now getting cooler. So a lot of people getting sick now. It's going to get worse. So weather going to get colder. So what we can do? Yeah, of course, when you have the flu, of course you can take paracetamol, take Calpol, fever. Yeah, using the Vicks is good to rub the chest, to rub the feet, which is good. And also drink a lot of water, have a lot of rest, and also do not forget. Now the GP or the surgeries has the flu vaccine and the COVID vaccine. So once you get better, try to get flu vaccine and COVID vaccine, but not all. Usually for elderly patients, free for elderly patients, I think more than 60 years old.
Okay.
Yeah, they give it. But also for the baby, there is RSV vaccine. I think RSV vaccine for the baby. For you, like you, Dylan, you have a baby. Yeah, so you can ask your GP or health center to get RSV vaccine.
That would reduce down the
Yes.
possibility of him getting the flu.
Yeah, and a lot of RSV infection during winter time. So I think that's why they ask for get the RSV vaccine. So, but for us who are adults or teenagers, we must take care of ourselves. We should drink more water, have a lot of rest, and if you see somebody who got infected or have a cough or flu, try not to be close to them. Yeah, and also hand hygiene. Don't forget about your hand sanitizer, everything. Yeah, that's it.
So I do a lot of. I think this came after he started Montessori. So we started play school. And
Yeah,
we would when we went to the salt play after the boys, we would wash his hands every time. And then we didn't get sick at all last winter. But I think now what we might do is we might wash his hands after Montessori.
yeah.
Just every time he comes out of Montessori, just give him
Good night.
a little bit of a
Yeah.
hand wash. And I think it'll help him a lot.
Yeah, exactly. So we have to not that you forgot about everything. Oh, there's no infection anymore. There's no COVID anymore. So when the
Okay.
germs still there. The germs still there. So
The
we better
germs
be
are still
careful.
there. It's important to wash your hands after going to like public spaces with loads of people.
Yeah.
Keep yourself as clean as you can, and then you're saying rest and hydration are key as well, right?
Yeah, exactly. Yeah.
What do you think about saunas and steam? They help with the chest.
Yeah, sure. Steam, yeah, especially for the nasal congestion.
Yeah.
Yeah, especially for the baby, they can't give any much medication, so we have to use nasal spray, normal saline nasal spray. Yeah,
Yeah.
so all those things can help with the child, the baby.
Okay. So we put them into the steamy shower, which I feel might help them a little bit to clear out the nasal passages.
Yeah.
Yeah. Okay. All right. Well, look, that's it for this week. We keep it short and sweet. Any other tips or tricks or anything you'd like to mention?
Not me. I think yeah, I think should. Yeah, that's why I said. Just have a rest, drink a lot of water, and then I got a fever, Calpol, or Nurofen. If not getting better in 3 days time, then you can let us know, or go and see your GP.
Perfect. Perfect. Thanks so much, Dr. Hampson.
Okay, you're
Okay,
welcome.
bye bye.